Reflexology is something that you hear more and more about every day. It's getting more and more standard even in chiropractic offices. And it's dealing with the ability to test the body, check the body on what might be strong or what might have a weakness to it. Basically, we work kind of like a battery. You know how we talked about energy and clockwise and all these gravitationals. Technically, when you put food in the mouth, there's an energy to the body that makes it go through these processes, and electrons are there, and free radicals are passed on, and all these things are happening. So that's really what we're tapping into when we talk with kinesiology. And the brain is this wonderful center that you can close what I call a circuit. You can take a circuit and close things and you can test it. The only thing it takes for kinesiology is two opposing muscles. So one of the classics that are used is an arm. You've seen them where they've used the fingers and break this point. I like to use the arm, and the arm is because it's a larger muscle. Someone that's getting introduced to it for the first time can maybe feel the change much more significant because you feel and you can see. When we start this test, it deals with basically holding your arm up, and just when I touch it, it has this nice consistent lock. It's not arm wrestling. We're not forcing and we're not pushing. We're just bringing our arm up in a state of what we consider relaxation. And I'm testing, and you'll feel a lock. When I test a point, like a joint, and if that joint is out, the energy that runs through this body, this battery conductor, will have a break in it, just like anything else, a light switch to a light bulb with a break in the wire. It will have a break in it. And this part, when we touch the arm, will have a very difficult time staying up. It will have a tendency to want to drop because we have shut down the energy in the body. Kinesiology has the ability to give us an idea where there's a weakness, because when we do that, if we're touching something and the computer chip realizes there's a break in strength because something might be low on energy or not functioning, it will create the two opposing muscles to become weak. And it becomes very apparent to the individual after a little bit of getting used to the process and understanding it for themselves. Most people will feel it after a couple of attempts, if not right off the bat. So kinesiology tells a lot, and it tells a lot even when you look at individual teeth, and we don't really know what the tooth is, but we can go in and close that circuit again and test that one tooth, and we can kind of pinpoint where we might want to look a little closer to get a better ability to diagnose. So no, it's not a diagnosis, but yes, it's wonderful information for a starting place to look.